Hi guys, I had K76. She's a married 47-year-old white female homemaker. She currently has 2 children and an 18-year medical history of systemic lupus erythematosus, and she complains of fatigue, anorexia, weight loss, swelling within the abdomen, face, and ankles. She currently has no known allergies. She does not smoke or drink. The current meds she's taking naproxen for joint pain and antacid for her heartburn. She's 5 feet 5 inches and weighs 102 pounds. She recently lost the 23 pounds since her last physical exam a year ago, which makes her BMI underweight. She has 4 brothers and 3 sisters. One sister has rheumatoid arthritis. Her aunt has pernicious anemia, and her mother, who is deceased, suffered from Graves' disease. 18 years ago, she complained of multiple rashes on her arms and legs when she went out running. She had several patches of hair loss on her head, which she attributed to flying, which terrifies her. She lacked energy, became tired easily, and needed to take naps throughout the day. At the time, she suffered from mild arthritis in her finger and elbows, which she attributed to growing old. Her ESR, which is her erythrocyte sedimentation rate, was 25, which is high and is consistent with an inflammatory reaction. After having her symptoms for 4 months, she finally saw a primary care physician. He ordered a tissue biopsy on her lesions, which revealed white blood cells within the walls of her blood vessels. Her blood smear was normal and her urinalysis was normal during the time. Her heart sounds were normal and she had no enlarged lymph nodes. At the time, her ANA, which is her antinuclear antibodies, were elevated. Her hematocrit was 23, which is low. Her red blood cell count was 3.5, which is low. Her white blood cell count was 5,000, which is normal. Her platelet count was normal as well. All her signs and symptoms cleared when she was placed on prednisone for 2 months. And again, 5 years ago, she went into the physician's office complaining of coughing and stiffening and pain in her hands and feet, which comes and goes and affects different joints. Her vitals at the time were her blood pressure was 140/90, which is stage 1 hypertension. Her heart rate was 105, which is consistent with tachycardia, and her temperature was 100 degrees Fahrenheit. Her urinalysis was normal. She had abnormal lung sounds, which suggest bronchitis. A chest x-ray was ordered, and it revealed mild pulmonary edema, but there was no white blood cells in the terminal airways. Her primary care physician showed concern about the patient developing pneumonia, and the axillary and inguinal lymph nodes were slightly enlarged. Her blood tests during that time was the hematocrit was 43%, which is normal. The platelet was normal. The white blood cell count was extremely low. After that visit, the patient was prescribed 10-day course of antibiotic therapy to prevent pneumonia and prednisone again. All signs and symptoms cleared after 3 months. Presently, during a physical exam, the physician noted the butterfly-shaped rash across the bridge of her nose and cheeks. Laboratory results revealed her hematocrit was 24, which is low. Her white blood cell count was 2,400, which was low. The urinalysis, which detected an abnormal protein concentration with presence of significant numbers of red and white blood cells. So a 24-hour protein collection was done, and it revealed an excretion of 2.5 grams, which is high. Given the information and the signs and the symptoms, as well as the ANA being high, the diagnosis for this patient has lupus, and generally patients with lupus are characterized by multiple relapses and remissions over a long period of time, usually decades, and it can virtually affect every organ system. The patient has treatment options, which is usually prescribed by oral corticosteroids can be used, but in cases where more severe or non-reactive to the corticosteroids, treatments can be prescribed as immunosuppressant drugs. Thank you.